Thalassemia is a major problem to us in India, and it merits urgent investigation and treatment. Hello, I am Dr. Soumya Bhattacharya. I am a consultant hematologist, hemo-oncologist and BMT physician attached to Apollo Multispecialty Hospital, Kolkata. I see plenty of thalassemia patients in my clinical practice, and first I have to explain to you that what it entails. Thalassemia is a genetic condition where the defective gene is handed down via generations from parents to their offsprings. And there are three major types or subdivisions of thalassemia. One is thalassemia major, where the baby becomes very ill at a very early tender age and is transfusion dependent from very young in life. The second is thalassemia trait or carrier, which is a very mild condition and where the hemoglobin is not reduced significantly and regular transfusion or other treatments are not required. And there is something in between which is called thalassemia intermedia, where the disease is not that severe but hemoglobin is still lower than normal and the patient requires treatment and other transfusion support from time to time. What is very important is that two thalassemia carriers should avoid marrying each other, because this is the way the majority of the thalassemia majors develop in our country. And if we can stop two thalassemia carriers marrying each other by making thalassemia testing mandatory before registration of marriages, then I think we can take a huge quantum leap in preventing thalassemia. But if a thalassemia indeed develops, for example, if there is a thalassemia major, then hope is at hand. Nowadays, with modern treatment, including blood transfusion and chelation therapy, we are getting a lot of these patients well. And these patients, if treated appropriately, often lead normal lives. They can study, they can graduate and do all the career defining works that they intend. They can have jobs, they can marry, and they can even beget children. And with proper treatment, a thalassemic child can even live up to 50, 60, 70 years nowadays. So if there is a thalassemia patient in your family, don't despair. Bring the patient to us, and with proper appropriate treatment, the patient would have a reasonable quality of life. In certain cases, we are also able to cure thalassemia by doing bone marrow transplant. So this is another option that can be offered to these unfortunate children in modern day and age. And thalassemia management is also improving every day. Newer drugs are coming and the overall picture is much rosier than before.